Hi guys, good morning. This is Dr. Denney over at Four Paws at Fulshear Veterinary Clinic, and today Maddie and I are going to be chatting about dog anesthesia and different types of anesthesia, what to expect, what are the possible risks and complications, potentially what are some breed sensitivities that we have to be on the lookout. And helping me today is my King Charles Cavalier, Aspen. She's my baby, so she's going to be helping us make this video.
Dr. Denney, when would my dog need anesthesia?
So dogs are going to need anesthesia or sedation for a multitude of different things. So for procedures, okay, any types of surgeries, sometimes for x-rays or if something is hurting. So if we have something come in that is acutely painful or a dog that's limping and isn't letting us take x-rays, then I'm going to usually give some pain meds. If that doesn't work, then we'll go ahead and do anesthesia / sedation to go ahead and keep them more comfortable. Anesthesia is used to manage pain and also make sure that whatever procedures we're doing is pain-free and non-traumatizing to your dog.
What are the different types of anesthesia and what's the difference?
Okay, so there's different types, just like Maddie said. So I'm going to kind of start with like an anesthetic procedure, like actual surgery, and then we're going to chat a little more about different small procedures that may not use the same protocols. So for major surgery, where we're going completely under anesthesia, including injectables and gas anesthesia, we're going to do a preoperative exam when they first get to the practice, which means we listen to their heart, their lungs, I'm going to check their gums, make sure there's nothing obvious going along with the cardiovascular system. We strongly recommend lab work. For any patient over the age of 4, lab work is required. That's making sure that there's not an ongoing infection, or making sure the liver and the kidneys are at optimal function, making sure there's nothing underlying that could preclude us from using anesthesia. After that, I'm going to go ahead and we will give an injection of pre-meds, okay? So this is going to be the equivalent to if you've ever had surgery and they've got your IV catheter in, which we do place, we give them something to kind of take the edge off, make sure they're not nervous, help them relax. So this is going to be a combination of injectable medication. We give it in the muscle, and over about 5 minutes, they start to feel really sleepy. During this process, they get moved over into preparation area on a nice fluffy blanket when they're nice and warm. We place an IV catheter, okay? IV catheter is going to give us IV access, allow us to administer fluids and other medications. You know all about this. You've had a couple of these procedures. She said, yes, I've had some tumors removed. Yes. So once we've gotten the IV catheter in, we actually do something called pre-oxygenation. So every pet that's going under anesthesia here gets 5 minutes of pure oxygen while they're getting sleepy. So they're not completely out, but they are on an oxygen mask. What this does is it hyperoxygenates their blood, because if there is some sort of complication or anesthetic reaction, that pure oxygenation that we do is going to buy us enough time to notice that there's a problem and to rectify it. Now, once the pet is completely asleep, we're able to go ahead and place a breathing tube to protect their airway. The reason that all surgeries are recommended to be fasted, including humans, is because of the risk of something called aspiration pneumonia. So when you can't control your body, sometimes you can get reflux or regurgitation or even vomit. And if that vomit gets into your airways, it can cause pneumonia. So we placed an endotracheal tube down the trachea and inflate a cuff, so it creates a seal where if one of our patients does vomit or regurgitate or even salivate, that material isn't getting into the lungs. Then they're placed on oxygen and gas anesthesia for maintenance. So that's going to be very similar to what they use in humans. We use isoflurane here, and it's a gas anesthetic, and it keeps them under. Then once that's happened, we move them into surgery or wherever they're going to be having their procedure. Full monitoring is hooked up. We monitor blood pressure, CO2 levels, oxygen levels, blood pressure, heat, heart rate, respiration rate, eye position, because the eye position in animals can actually tell you how deep they are under anesthesia, and we have full EKG leads on them as well. So here at Four Paws, the same kind of monitoring that you have done at the human hospital, you're going to have here. I'm a bit of a stickler for that, but the good thing is while we have that monitoring, it's going to allow us to catch a problem and rectify it. So those are the different types of kind of anesthesia. Then we're going to move on to, well, what is sedation? What's the difference between the two? So anesthesia is when you are fully asleep and you are not aware of anything. Sedation is kind of where we give them maybe Valium, something to take the edge off. So if you're going in to have a dental procedure and it's not comfortable, but it's not bad, they're going to maybe give you laughing gas. We're going to usually do injectable sedation where you're going to be a little bit sleepy, a little more relaxed, and you may be a little bit aware of what's going on, but you're not stressed. So with sedation, they're not completely out. And yes, with sedation, depending on how sleepy they are, I will usually have them managed on some flow by pure oxygen on a face mask. Very similar to what happens in humans. If you're going in to have an upper GI scope, they put you on just pure oxygen, but you are able to breathe on your own. And those are the different types of anesthesia.
Are particular dog breeds more sensitive to anesthesia?
So yes and no. Okay, so like our sight hounds, so our greyhounds, our Afghans, Italian greyhounds, our whippets generally don't take as much sedation, and we do have to be, they can be a little more sensitive to sedation and anesthesia, so we do have to be careful with that. The boxers, typically I don't like to use a medication called acepromazine in boxers, more using it as a pre-anesthetic agent, so like a pre-med. I'm usually going to stay away from that in boxers. Other than that, if your dog or cat has a pre-existing condition, so I'm not going to use medications like ketamine, which if you are prone to seizures, ketamine can induce seizures sometimes. So I'm probably not going to use that in a patient we're concerned about. I'm also going to change my anesthetic protocol for conditions. So if your dog has a heart condition and we've done the x-rays or maybe even had a cardiac echo to make sure the heart can withstand anesthesia, then I'm going to use what's called cardiac friendly anesthesia, so something that's going to have very low risk or very low pressure on the cardiovascular system, something that's just going to affect kind of the awareness of the brain and not going to affect the function of the heart or the lungs.
What are some possible complications of anesthesia that my dog could experience?
That's a really great question. I think this is the biggest part about anesthesia and why it makes it so scary. And you know what, I'm right with you. When Aspen has to go have a dental procedure, which we do here, my stomach's in a knot because there are risks. They are very low. The risk of complications and risks are low with every anesthetic procedure, but they are there. And it is something we need to be aware of. So sometimes they can have an underlying arrhythmia that we have no idea. And sometimes you can't hear this on an exam. And if one of the pre-medications that we use induces a fatal arrhythmia, I mean, their heart can stop. So that is a big fear. It's very rare. I personally have only had, I think, 4 patients in 10 years that this has happened to. 3 of which we were unable to revive, 1 of which we got back, but it sticks with you and it is a risk. It's the same with human medicine. There's always a little bit of a risk. There's a risk that they could aspirate. So even though we have a breathing tube down protecting their airway, it's not 100%. It's pretty close to it. So it's very rare for them to aspirate or have fluid or vomit or regurgitation go down the wrong pipe and into their lungs. That is not common. I've maybe only had it 1 time in 10 years of practice, but it is possible. We can also see getting cold under anesthesia. So part of what we do is we provide a lot of heat support with what's called a bear hugger, and that blows warm air, just very similar to what humans have. But when we get cold, our blood pressure can be harder to keep up, so keeping them warm is going to be important. Another thing that we do to avoid low blood pressure, because that can hurt organs. When you don't have enough blood pressure, that's what's perfusing or giving oxygen and nutrients to your organs. And one of the first organs that's going to feel it or start to get in danger if the blood pressure is low is the kidneys. So part of why we manage the blood pressure and monitor it and have them on IV fluids is so we can make adjustments. So if we start to notice that a pet is getting low blood pressure while under anesthesia, we are going to lower the anesthesia and increase the fluids and start checking to make sure body temperature is good. We're going to make adjustments to make sure that we can avoid having organ dysfunction. But there are risks and complications with every procedure. They are low, but they're there. And I think that's an excellent question to ask. And I can tell you that with every patient that goes under anesthesia, they are our babies too. They might be your pets and your babies, but while they're here, they're under our care and they get 100% of our attention.
What do I need to watch for at home after my dog has undergone anesthesia?
I think that's a really great question. And I'm going to use Aspen as an example because she's had procedures here and at the specialty hospital before, and I'm going to kind of talk to you about things that I saw. So here with our protocol, we may see a little bit of sleepiness for about 24 hours. Their appetite can be a little funny for a day or two. That's not abnormal. They can have a little bit of tummy upset, very similar to humans. From having the breathing tube down, sometimes they can cough for a day or two. That's normal. They can be a little lethargic because it takes time for the drugs to work their way out of their system. And if you have an older dog, it's going to take a little bit longer. So it's not uncommon to see a day or two for the anesthesia to work its way out. Aspen, when she went to go have her CT done, or no, it was an MRI over at the specialty hospital, I don't remember what drug combination they used, but it's not one that she's usually had. And when she came home, she did not stop panting and whining for like 8 hours, to the point where I almost I was giving her something else to kind of take the edge off. So for her, that specific anesthesia wasn't great because the combo that I've used on her before, she goes home and she's a little drowsy, but she's okay. So that's another thing. It's a little bit of trial and error and figuring out what works best for each pet. I can tell you that we do tailor our anesthesia to each individual patient. And based on their past history is always important because I do have some patients that don't react well to certain drugs. So guess what? We don't use those on those patients. We make adjustments, but it's definitely something to be aware of. If they're not eating within 24 hours, you do need to give us a call. With all of our anesthesia patients, they do get anti-nausea medications that last for 24 hours. If we're vomiting, then we do need to have a call. If there's any diarrhea, we need to have a phone call. If we're uncontrollably panting and it's not going away for about 8 hours, it's not uncommon for a few hours, but more than that, we need a phone call. But those are all things to kind of keep an eye out for. Thanks guys for joining us. If you have any additional questions about anesthesia, please feel free to give the clinic a call. Thanks so much.